He has a special expertise in renal nutrition, holds 5 LLL certifications from IAPN, SPEN, done FODMAP course from Monash University, Australia. She is the former General Secretary of the Indian Dietetic Association, now holding the National Treasurer post. And she has many publications, and she has also written articles in various newspapers, magazines, and e-papers. A lot of achievements to her credit. Welcome, ma'am, and over to you for the session.
So as it is, we are going a little behind, so I would request to display the screen of the first speaker. So now our speaker is Dr. Moitrey Mukherjee. He is MBBS MD in Anesthesia, Associate Professor and HOD of Emergency Medicine with this prestigious institute, IPGMER and SSKM. She has done more than 10 publications, external examiner of DA, internal examiner of emergency medicine, speaker of several national and state level conferences. She is a member of ISA and AIDA. Her special interest in pain management and difficult airway management. So, stage is yours, ma'am.
Madam, for the kind introduction, and I'm happy to be associated with this prestigious association. My topic for today is role of immunonutrition in GI trauma. So, immunonutrition is a study of the relationship between nutrition and the immune system. It involves understanding how nutrients and bioactive compounds in food affect the immune system's function and how this can impact health and disease. So this will be focused on supporting the immune cell function and development, regulating inflammation and oxidative stress, modulating cytokine production and immune responses, and maintaining gut barrier integrity and microbiome balance, and influencing gene expression and epigenetics. The key aspects of immunonutrition is gut-associated lymphoid tissue. It is regarding the nutrient absorption, cytokine modulation by the body, the gut barrier function, inflammation reduction, and surgical recovery. So after trauma, infection or burn, there is excess immune system activation. On one hand, we have pro-inflammatory cytokines that will produce oxidant, antioxidant defense, and that will help in pathogen killing as well as tissue damage. Like in our previous speakers already told that during cancer or any injury, there is excess protein breakdown in the body. The feedback systems goes to the IL-10 and heat shock protein, and there is appetite loss, and so there is requirement of immunonutrition during a surgical stress or stress after trauma. The key immunonutrients that are of concern and being discussed in previous session also are glutamine, probiotic, vitamin D, arginine, omega-3 fatty acids, and nucleotides. Let's discuss one by one. So the glutamine is the most abundant free amino acid in the body. Muscle stores of glutamine rapidly depleted in catabolic stress states, and trauma is a catabolic state. Glutamine is important for rapidly dividing immune cells, which is an energy substrate for lymphocytes and neutrophil. Nucleotide synthesis is stimulated by glutamine. It is the fuel for enterocyte in gut. It induces production of heat shock protein and synthesizes endogenous antioxidant glutathione. Glutamine supplementation has been shown to reduce the gut barrier permeability. It improves the immune function, it decreases inflammation, it enhances gut motility, support gut mucosal health, reduce oxidative stress and improve the wound healing outcomes. Here is a comparison that if IV glutamine is given, it can decrease the length of ICU stay for 2 to 3 days. So 7 days IV glutamine comparable to 3 days ICU stay has been compared in this table, and it has seen that addition of glutamine will be definitely helpful for recovery of the patient. The next thing that is of concern is omega-3 fatty acids. It reduces the inflammation and oxidative stress. It improves the gut barrier function and reduce bacterial translocation. It enhances immune function and reduce the infection risk, improve wound healing and reduce complications, and it support gut motility and reduce the ileus risk. Fish oil. Cold water fish are rich in eicosapentaenoic acid and docosahexaenoic acid. Because we know humans have limited capacity to synthesize this DHA and EPA during basal condition from alpha-linoleic acid through desaturate enzymes. During acute illness, these desaturates are markedly down-regulated, so that EPA and DHA synthesis from ALA is negligible. The supplementation of omega-3 fatty acid in critically ill patient require administration of fish oil-based lipids. What it does, it displaces the amino acid from phospholipid core of the inflammatory cell like macrophage or neutrophil, and it reduces the synthesis of pro-inflammatory eicosanoids. It reduces leukocyte and platelet adhesive interaction with the endothelium. It inhibits the inflammatory gene expression, reduction of oxidative injury by stimulating glutathione production, and it enhances anti-inflammatory resolving, and it also has lung protective effect mediated by release of gut-derived inflammatory mediators into mesenteric lymphatics and thoracic duct. The next thing of concern is arginine. Is essential in certain type of critical illness. The beneficial effects of arginine are, it is secretagogue for release of anabolic hormones, support immune T cell function, it detoxification of ammonia it helps, and involved in wound healing via metabolism of polyamines to proline, but excessive production linked to mortality in septic shock in few studies. Arginine plays a crucial role in GI trauma by enhancing the immune function, reducing the inflammation, improving the gut barrier function, modulating cytokine production, supporting gut motility, enhancing wound healing and reducing the oxidative stress. The next immunonutrient is vitamin D. Vitamin D supplementation in GI trauma has been shown to improve the immune function, reduce inflammation, enhance gut barrier integrity, support gut mucosal health, promote wound healing, and reduce the risk of infection. Vitamin D plays a significant role in GI trauma by regulating the immune cell function. Vitamin D modulates the immune response, reducing excessive inflammation and promoting immune homeostasis. It maintains the gut barrier integrity, reducing the risk of bacterial translocation and infection. It reduces the inflammation by mitigating excessive inflammation and tissue damage in GI tract. It enhances the gut motility, reducing the risk of ileus and other motility disorders that are of very much concern after GI trauma. And it supports the gut mucosal health, which is essential for health and integrity of gut mucosa. It also modulates the cytokine production, reducing excessive inflammation and promoting immune homeostasis, and it supports wound healing by production of collagen, promoting faster recovery from GI trauma. The next set of concern is with probiotic that are much talked about. Probiotic, it has a communication with brain and gut. As you can see in the flow diagram, it adherence to gut mucosa causes improvement of gut barrier integrity, it production of organic acid and antimicrobials, it regulate and restore gut dysbiosis, it regulate enzymatic function and cause immune modulation. Antioxidant vitamins and trace element. Antioxidant defense mechanism include enzymes like superoxide dismutase, glutathione peroxidase, trace elements like selenium, zinc, vitamin C, E, beta carotene and sulfhydryl group donors like glutathione. Critical illness is associated with deficits in antioxidant due to redistribution from blood to tissues due to increased losses and decreased nutritional intake. Fat-soluble vitamins like A, D, E, K play a crucial role in GI trauma by supporting immune function and reducing inflammation. It maintains the epithelial health and integrity. It regulates antioxidant defenses and reduces the oxidative stress. It supports wound healing and tissue repair. It maintains bone health and prevent bone loss and regulate blood clotting and prevent bleeding complication. Supporting the health of the gut associated lymphoid tissue is also done by these vitamins. Trace elements play a crucial role in GI trauma like zinc. It is essential for immune function, wound healing and protein synthesis. Iron, it is vital for oxygen transport, immune function and energy production. Selenium, it acts as an antioxidant protecting against oxidative stress and inflammation. Copper, involved in immune function, connective tissue health and antioxidant defenses. Manganese, it plays a role as antioxidant defenses, wound healing and bone health. Chromium, important for glucose metabolism and immune function. And molybdenum act as a cofactor of enzyme involved in detoxification and antioxidant defenses. Glutathione in GI trauma, supplementing glutathione or its precursors like N-acetylcysteine may help enhancing the antioxidant defenses, regulation of inflammation, protection of gut barrier, support immune cell function, promote detoxification, support cell survival and proliferation, enhancing tissue repair. Nucleotides, this is another type of nutrient. It is important for synthesis of DNA, RNA and adenine nucleotides, primarily derived from diet, but ability to synthesize coenzyme during catabolic stress is impaired. Without dietary intake, there is selective loss of T helper lymphocytes and suppression of interleukin-2 that promote immune function, as well as poor clearance of pathogen and reduced mortality from graft versus host interaction. So there are several recommendations by several bodies like CCPCG based on 3-level recommendation. The use of supplemental combined vitamin and trace element should be considered in critically ill patient. Aspect recommendation, combination of antioxidant, vitamin and trace mineral, especially include selenium, should be provided to all critically ill patients receiving specialized nutritional therapy. This is grade B recommendation. And ESPEN recommendation is all parenteral nutrition prescription should include a daily dose of multivitamin and trace element this has been also given importance in previous lecture, that addition of micronutrient on weekly, Sip Shankar has told that weekly twice addition of micronutrient is important in any patient who is recovering from stress. So what is the timing of immune nutrition? Preoperative immune nutrition had most beneficial effect. It is greatest benefit for malnourished patient. Reduction of post-op mortality, reduction in non-infective post-op complication and wound infection, and reduce hospital stay. In previous sessions I said, before starting cancer therapy, you should optimize the nutritional support of the patient so that the patient is prepared for the next coming ward. These are my references. Thank you.
Thank you.